open surgical procedures where we do a bypass surgery and put a brand new blood vessel, either made out of the patient's own vein or out of a prosthetic device, into the patient's leg to carry that blood down to wherever it needs to go. The other more modern option is endovascular surgery, where using small catheters placed inside a vein through just a simple needle or into an artery through a simple needle, a balloon can be passed to the site of blockage and inflated to break the blockage up, which often will improve the symptoms for at least a short period of time.
Open surgery is just like any other operation for vascular surgery, and it does require a patient stay 3 or more days in recovery. Endovascular therapies like angioplasty provide less invasive procedures on the patients, require shorter recovery time, and significantly less pain. Evelyn's recovery time was minimal, and 3 years later, she's healthy, happy, and active.
I use the vegetable broth, the fat-free.
And since then, I've continued with my exercise. We walk all the time. My husband and I walk all the time. I try to keep my diet as best I can, and I've been feeling wonderful.
This is just easy, fat-free vegetable soup.
Evelyn's diet has changed for the better. She and her husband eat mostly vegetable-based meals and look forward to many years together.
Smells good already. Overall, not too bad.
Nothing compared to the 4 years of suffering.
Caroline and Dr. Jaff's team had more obstacles to overcome. And with their team approach, Dr. Jaff referred Caroline to an expert to perform angioplasty. Caroline says it gave her her life back.
So I walked out with my leg and my kidneys. I get the goosebumps when I think of it. So he's just been like a guardian angel. I get to keep both, my leg and my kidneys.
Caroline feels better today than she has in years. Her recovery time was fast, with only one night stay in the hospital. She was back on her feet by the next afternoon.
It was incredible. The next afternoon, I was like up and walking down the halls with no pain. It was just an incredible thing. It's been so many years since I had it. The nurses were running after me to give me my meds. I just could not believe I was able to walk and not be in excruciating pain. And I haven't, it's been unbelievable.
Most patients are able to walk again with minimal discomfort, and that makes patients and physicians pleased with their outcome.
You know, anytime you're able to improve someone's way of life, it's always good news. Thanks, Carlos. And as well as these techniques are working today, researchers continue to look forward to new and better ways to treat PAD. Scientists and physicians recognize how common PAD is and how important it is, and the fact that we really have not devoted enough time and resources to it.
So we're finding a number of drugs and other treatments that are undergoing intensive scientific evaluation, many of which have real promise for the treatment of peripheral arterial disease. And some of these drugs will be used to prevent plaque progression. Drugs look like they're going to be able to circumvent the flow of blood around blockages by developing new blood vessels.
The most important thing for the public to know about peripheral arterial disease is that it does exist, that the aches and pains that people get as they grow older are not always simply due to increasing age, and that there may actually be an underlying disease that can be successfully treated. Anytime a patient finds themselves having pain when they walk, especially if it requires them to take a break from walking for a minute or two to let that pain go away, really should talk to their doctor earnestly about these symptoms and try to find out what's causing them, because often simple treatments can really save significant problems in the future.
Our technology is better, so we're able to do more with catheters, and the amount of the number of specialists who can do the procedures have increased. So we know more about the disease, we're picking it up more often, and we have the technical skills and the personnel to do it.
Caroline has a renewed outlook on life.
Every day is worth living, and there's always somebody out there to help you and never to give up. And if one person doesn't listen to you, You just be persistent until someone does, because there are amazing things out there that can help people nowadays, and there's no reason to suffer.
It's a very exciting time. We're given opportunities now to really have an impact on patients' lives through simple, risk-free maneuvers. And I think that it gives us great promise and hope that we'll have impact on these patients' survival and quality of life down the road.
Whatever course of treatment the physician recommends, patients are becoming more responsible and changing old bad habits, such as smoking and high-fat diets, to dramatically improve their lives. Taking control of your own health care is the best prevention for everyone. That's it for this edition of Healthy Body, Healthy Mind. I'm Dr. Perry Kritschmar. See you next time.